All right, let's talk about something that millions, and I mean millions of people deal with every single year, the urinary tract infection, or UTI. It's one of the most common infections on the entire planet. But for something so common, there's a surprising amount of confusion out there. What exactly is it? Why does it happen? And maybe most importantly, what's the right way to treat it? Well, today, we're going to clear all that up.
If you've ever had a UTI, you know exactly what I'm talking about. That awful feeling, the constant nagging need to go, combined with that painful burning sensation. It can totally derail your day, your week, your life. So what is really going on inside your body to cause all that misery? Let's dive in and find out.
Okay, so here's our game plan for today. We're going to start with the absolute basics. What even is a UTI? Then we'll get into a really important point, that not all UTIs are the same. After that, we'll cover how doctors figure out what's going on, and of course, how to treat it. We'll also tackle the frustrating problem of recurrent infections, and finally, we'll wrap up with some special situations like pregnancy, and we'll bust a few very common myths you've probably heard.
All right, first things first. We hear the term UTI all the time, right? But what does it actually mean, medically speaking? Let's break it down. So at its most basic level, a UTI is just an infection somewhere in your urinary system. And you can kind of think of your urinary system like a super efficient plumbing network. You've got your kidneys, which are the filters, pulling waste out of your blood to make urine. Then that urine travels down these little tubes called ureters into the bladder, which is basically the storage tank. And finally, it all exits through the urethra. Now, this whole system is supposed to be sterile. A UTI happens when some unwelcome bacteria manage to sneak in, set up camp, and start multiplying. And that's what causes all the inflammation and the painful symptoms. And the symptoms of the most common type of UTI, a simple bladder infection, are really unmistakable. You've got that classic burning feeling when you pee. The medical term for that is dysuria. Then there's the frequency, which is that maddening feeling that you have to go all the time, even when you know there's nothing left. And that's usually coupled with urgency, that sudden panicked feeling of, I need a bathroom like right now. On top of all that, you might feel this dull pressure or pain right below your belly button. That's called suprapubic discomfort.
So who are the culprits here? What kind of bacteria are we dealing with? Well, it turns out there's one main villain in this story. A whopping 80 to 90% of simple UTIs are caused by a single type of bacteria, E. coli. You've probably heard of it, E. coli. Now, E. coli is totally normal and harmless when it's in our gut, where it belongs. The problem is when it travels from where it's supposed to be to where it's absolutely not supposed to be, your urinary tract. And just due to basic anatomy, this is why UTIs are so much more common in women.
Okay, this next point is really important, and it's something a lot of people don't realize. The term UTI is super broad. It's kind of like saying you have a respiratory infection. I mean, a common cold is a respiratory infection, right? But so is pneumonia. They're totally different things. The exact same idea applies to UTIs. Where the infection is located, well, it changes everything.
Yeah, the two main types are just worlds apart. On one side, you have acute cystitis. That's the one we all think of, the classic bladder infection. All those symptoms we talked about, the burning and urgency, they're local. They're stuck right there in the bladder. But if that infection isn't treated, the bacteria can actually start to travel up the ureters and get into the kidneys. And that's when you get something called acute pyelonephritis. This is a whole different ballgame. It's way more serious because the infection isn't local anymore. It's gone systemic. It's affecting your whole body. And that's why the symptoms get so much worse. We're talking high fevers, serious pain in your back or side, and sometimes even nausea and vomiting.
And that brings us to another key distinction, the difference between an uncomplicated and a complicated UTI. Now, this is super important. Complicated doesn't necessarily mean your symptoms feel worse. It's all about the context, the patient's situation. An infection gets labeled complicated if there's some other factor involved. Maybe the person has a kidney stone or an enlarged prostate, or they use a catheter. And here's a fascinating fact. Almost every single UTI in a man is considered complicated by default. And you might wonder why. Well, it's because the male anatomy provides a much longer path for bacteria to travel, which is a pretty good natural defense. So if bacteria still manage to cause an infection, it's a big red flag that there might be some other underlying issue that needs a closer look.
So, we know there are different kinds of UTIs, but how do doctors figure out which one you have? You might think they always need a lab test, but that's actually not true. Which brings us to a really practical question: to culture or not to culture?
Okay, so when do you need that test?
Well, for a healthy woman who gets a bladder infection every once in a while and has all the classic symptoms, a doctor can often just diagnose it right there on the spot. No lab needed. But in pretty much every other situation, they're going to want a urine culture. That's when they send your sample off to the lab to literally grow the bacteria. Why? Because that test gives them two crucial pieces of information. First, what exact bug is causing the infection, and second, which specific antibiotics will actually work against it. So a culture is an absolute must for a suspected kidney infection, for any complicated UTI, and as we've talked about, for all men and for any pregnant patient.
Okay, so a diagnosis has been made. Now what? Time to talk treatment. And really, the main way we treat UTIs is with antibiotics. But, and this is a big but, which antibiotic to use is a moving target, all because of the growing global problem of antibiotic resistance. So for that standard, run-of-the-mill bladder infection, there are a few go-to, first-choice antibiotics. First up is nitrofurantoin. It's a real workhorse, usually prescribed for 5 days. Then you have SMX/TMP. It's a combo drug that can knock out an infection in just 3 days. The catch? E. coli has gotten pretty smart and developed a lot of resistance to it over the years. So the rule now is to only use it if local resistance rates are low, less than 20%. And the third great option is fosfomycin, which is super convenient because it's just one single powerful dose.
Now, I have to talk about a specific class of antibiotics you've probably heard of and maybe even taken, the fluoroquinolones. The most famous one is ciprofloxacin, or Cipro. For years, Cipro is the go-to drug for UTIs, but that has changed big time. Health agencies now have issued really strong warnings against using these for simple bladder infections. There are two big reasons. First, they can have some serious side effects. And second, and this is just as important, we've overused them so much that we've created a ton of resistance. The bottom line is, we have to save these heavy hitters for more serious infections where nothing else will do the job.
But what happens when that infection climbs up to the kidneys? Well, the treatment has to escalate right along with it. A kidney infection is a serious deal, and it often means a trip to the hospital for IV antibiotics. We need to get that strong medicine into your system fast. And this is where the big guns come out. You'll see drugs like fluoroquinolones. Yep, this is where they belong. And other classes like cephalosporins and aminoglycosides. You don't need to memorize the names. Just know these are powerful, broad-spectrum drugs. And way at the top of the pyramid, you have the absolute last resort antibiotics, the carbapenems. Those are saved for the toughest, most resistant superbugs out there. You know, for some people, a UTI isn't just a random one-off thing. It becomes this frustrating, endless cycle. So the big question is, how do you break that cycle? Let's get into the strategies for dealing with recurrent infections.
First off, what does recurrent actually mean to a doctor? It's not just getting a UTI every few years. The clinical definition is very specific. It's either having 2 or more infections within 6 months or 3 or more infections within a year. Once you hit that threshold, it's a sign that the whole strategy needs to change. It's not just about treating the infection you have now, it's about preventing the next one from ever starting.
Right, so for people with recurrent UTIs, the name of the game is prevention, or what doctors call prophylaxis. And there are basically 3 ways to do it. The first approach is patient-initiated therapy. This is all about empowerment. Your doctor gives you a prescription to have on hand, so the second you feel those first telltale symptoms, you can start treatment yourself immediately. The second strategy is post-coital prophylaxis. This is specifically for people who notice their UTIs are triggered by sex. It's simple. You take a single dose of an antibiotic right after intercourse to stop an infection before it can even start. And finally, for people with really frequent UTIs, there's long-term prophylaxis. This involves taking a very low dose of an antibiotic every single day for 6 to 12 months, just to keep things clear.
All right, let's shift gears and talk about a few special topics: pregnancy, prevention, and some of those myths that just refuse to go away.
When it comes to pregnancy, managing UTIs is a huge deal. It's so important, in fact, that it's recommended that all pregnant patients get screened for bacteria in their urine between 12 and 16 weeks, even if they feel totally fine. You might be wondering why. Well, it's because even harmless-seeming bacteria can quickly turn into a full-blown kidney infection during pregnancy, and that can lead to really serious problems, like preterm labor or a low birth weight baby. And of course, the choice of antibiotic is critical. Certain drugs, like the fluoroquinolones we talked about, have to be avoided to keep the baby safe.
Okay, myth-busting time. Let's tackle the 2 biggest ones you always hear about. First up, cranberry juice. Look, I know it's a home remedy that's been around forever, but when scientists have actually studied it in big clinical trials, the results have been really inconsistent and, well, not very convincing. So here's the bottom line. Official medical guidelines do not recommend cranberry for preventing UTIs. Myth number 2, probiotics. The idea sounds great, right? Use good bacteria to fight the bad guys. It makes sense. But for right now, there's just no solid scientific evidence from clinical trials to back it up for UTIs.
And now we come to what might be the single most surprising takeaway from all of this. Sometimes, when you find bacteria in the urine, the best course of action is to do absolutely nothing. Yeah, you heard that right. When we find bacteria in someone's urine, but they have 0 symptoms, a condition called asymptomatic bacteriuria, treating it is usually a bad idea. In fact, it can cause harm. It can wipe out the easy-to-kill bacteria and leave the stronger, more resistant ones to take over. This is a perfect example of why being smart with antibiotics is so critical. The only big exceptions to this rule? Pregnancy, which we already covered, and right before someone has certain kinds of urological surgery.
And that really brings us to the big picture here. UTIs are unbelievably common, and for now, we have good antibiotics to fight them. But the bacteria, they're not just sitting around. They are constantly evolving, getting smarter, and becoming more resistant to our drugs. So every single thing we talked about today, from avoiding powerful antibiotics for simple infections to leaving harmless bacteria alone, it isn't just about treating one person's infection. It's about a much bigger, global fight to preserve the effectiveness of these amazing medicines. And that leaves us with a really sobering question to think about. As antibiotic resistance continues to grow, how are we going to keep fighting one of the world's most common infections? Thanks so much for joining me.